Okay, everybody, we are almost finished. We are on pillar number 9 of our platform. We are on welfare services for the CHP. I'm Kevin Schulthies. Watch all the other videos down below. And here we go. So, general statements as basic human needs. We affirm that Canadian residents should not lack essential food, shelter, clothing, but to be our brother's keeper does not establish an indiscriminate and universal claim on public charity for those able but unwilling to work. Welfare services should be provided by government only after the prior spheres of responsibilities have been exhausted, namely the individual's self-initiative. Number 1. Have been exhausting. Other members of the family and voluntary society agents, municipal, provincial, and federal authorities should cooperate in formulating effective programs in meeting human basic needs. This is huge. Basically means, yes, we can be our brother's keeper in the extreme cases when everything else is exhausted, but your number one need is you need to be willing to work. You need to be willing to work. And it's based on your self-initiative as well. If you don't have any self-initiative, the Bible says, well, you should probably, if you can work and you're not working, you should probably go hungry. That's a biblical term. A little harsh, but good policy, actually. All right? Family stability. We believe that the prevention of hardships, rather than its alleviation after it has risen, is the key to reducing welfarism. So prevention is better than dealing with problems. And that has the stability of the family, and that the stability of the family is integral. Believe that government should assist. Government assistance should be given to humanitarian and church-based programs which minister to the hurting, strive for reconciliation in marriage through counseling, support those involved in crisis pregnancies, and seek to help an individual overcome those factors, physical and spiritual, which inhibit self-reliance. We favor assistance for the deserving poor through programs which encourage individuals to be self-reliant. So basically, this is actually even more than just family stability. This goes into social programs and everything. Basically, CHP is saying we want self-reliance. We should encourage programs that encourage getting out of habits, bad negative habits, drug habits, pornography, things that destroy families, things that destroy self-reliance, abilities to work, encouraging slothfulness or less than genuine behavior for society. We want to encourage those programs that actually fix marriages and encourage marriages to stay together, and stability. That's the foundation. That's where the family stability clause comes in there at the head there, is when a stable family is promoted, then you can prevent a lot of problems long term. Self-reliance. This is huge. Government should strive to eliminate the universality of welfare, restricting it to those that are in genuine need. No one who is able but refuses to work has a claim to be supported by others. Those able-bodied individuals who apply for state welfare and are otherwise not bound by having to care for dependents should be obliged to take part-time or seasonal employment or other public services if such are available in the community or can be secured by social welfare agencies. Basically, if you can work, you should work. And if you are not working, you should starve. Simple as that. And everybody that can work should work. Simple enough. We're the ones that said it. The Bible said it way before we did. So, health services, private medical. CHP would not hinder the provinces from establishing privately funded and privately operated medical centers, which would provide local delivery of recovery and life-saving treatments, diagnosis, and surgery for parents. I am a huge proponent of private health care. It can be done cheaper and more efficiently, And if somebody wants to pay for faster service, let them pay for faster service. It's taboo to talk about our public healthcare system when we pay huge amounts for it. Not only cost-wise is it a huge cost, but in inefficiencies, in non-competitiveness, in time waited, we pay costs that are just atrocious. But if we can have a combination of private and public, fine, so be it. I highly encourage it. And I highly encourage everybody to actually, save up money and, participate and, pay for a lot of their own health care. And I would even go further, is if you take care of yourself and you make positive choices in your life, you should actually, I believe I've seen other systems where you develop where if you don't spend money, your healthcare dollars, on systems because you're spending money in your life, you're investing money into yourself for a healthy body, for healthy lifestyle choices. You don't smoke, you go out, you eat properly, you take care of your body properly, you actually can get reimbursed for those things as well, because you actually are saving the country money, which I would actually encourage. Preventative medicine. We believe that healthcare is first a personal responsibility. However, is in the interest of national health. Public awareness programs should introduce and promote benefits of preventative healthcare. Nutrition, exercise, relaxation, moral living. All those things can actually bring about a better healthcare system because you have healthier people. Classification of health supplements. Health Canada should establish safety standards such as better requirements for labels for vitamins and natural dietary supplements, but such supplements should not be classified as medicine or drugs, but could be under the Codex Alimentaris. Ailments, I guess. Provincial jurisdiction. The federal government national healthcare budget should in large measure be appropriate apportioned to the provinces on the basis of population to augment provincial government subsidized medical insurance. Recipients of medical services should receive a statement of fees paid on behalf of their government. That's very interesting. Basically, it's saying if you do receive medical treatment, you should get billed, but you should see the bill and what its fees were and what it's being paid. Because if your government's paying for it, technically you're paying for it, and you should know what your health care is, and then you can actually go, wow, they're charging, how many hundreds of dollars for band-aids or stitches or this or silly little things or how much. You'd be appalled, and then that would actually bring in better business practices to our systems. Sexually transmitted diseases. As with any communicable disease, STDs must be dealt with as a public health issue, not a civil rights issue. A national advertising campaign should be implemented which stresses that virtue is a necessity, not an option. Educational media should be publicly presented which teaches that the only safe sex is chastity until marriage and fidelity within marriage. Patents. The government prohibit the practice of pharmaceutical companies of changing product specifications, currently known as evergreening, which indirectly extends patent protection and is an abuse of patent law. So changing little tiny things to ever keep their patents and their drugs being patented. Okay, veteran affairs, here we go. Recognition. We affirm that more honor and recognition is warranted on behalf of Canadian surviving veterans and spouses in order to remind young people that the high cost of Canadians have paid in previous generations to preserve our freedom. Okay. Eligibility to serving with our declared allies, NATO or NORAD, or other support things such as the Merchant Marine in any theater of combat should be duly recognized and eligible for veteran benefits. So maybe it's not, I'm not sure. I'm not that familiar with any of this. Benefits. Veteran benefits must keep pace with increases in cost of living. Fair enough. Youth. Government's roles. We affirm that the government should serve as facilitator of useful information and statistics which can assist Canadians' youth in planning their careers. The role of government with regard of youth should not be that of an employer charged with providing work, creating jobs, or designing innovation and costly relief programs. Through public education, media, and other means, Canadian young people should be challenged to think of what they can do for their country rather than what their country can do for them. Basically, that means the government is not your baby. It's not our job to tell you what jobs to pick or what education to pick. We can provide you some good information, and you pick the career and education and self-education and continuing education throughout the rest of your life to constantly adjust. If you are in a dead-end job and your career or your industry changes, or if you're in the oil industry and the oil prices drop and you get fired, well, guess what? You need another career. And it's not the government's job. That is your job. You need to read the writing on the wall and be self-sustained. So definitely learn. And the government can provide some education on some generalities, but it's not the government's job. Your job is to work, provide for your family, not be on welfare, and it's not the government's job to hand you a check. Your job to keep working and keep yourself fed.